00015. Ready to take the guesswork out of giving intramuscular injections? This video will provide you with a comprehensive guide to ensure you can perform this procedure with confidence and precision. Whether you're a healthcare professional or learning for personal care, I've got you covered. Intramuscular injections are a common method for delivering medications directly into the muscle, and mastering this skill is essential for effective treatment. Let's master the art of intramuscular injections. By following these steps, you'll be able to administer injections safely and efficiently. 015-045. Hi, I'm your name, and today I'll guide you through the essential steps for performing an intramuscular injection safely and confidently. We'll cover everything from preparation to aftercare, ensuring you have all the knowledge you need. With these simple instructions, you'll be ready to administer injections like a pro in no time. Remember, practice makes perfect, so don't be discouraged if it takes a few tries to get it right. 045-100. First, make sure you have everything you need: a syringe, needle, alcohol swabs, gloves, and the medication. Having all your supplies ready and organized is the first step to a successful injection. It's crucial to have all your supplies organized and within reach to ensure a smooth process. This not only saves time but also helps maintain a sterile environment. 100-130. Now, prepare the injection by drawing the correct dose into the syringe. Make sure to double-check the medication and dosage to avoid any errors. Be sure to remove any air bubbles. This step is crucial as air bubbles can cause discomfort and affect the accuracy of the dosage. This step is vital to ensure accuracy and prevent complications. Take your time to tap the syringe and push the plunger gently until all air is expelled. 1:32:00. Next, select an appropriate site. The choice of site can depend on the type of medication and the patient's condition. Common choices include the deltoid, thigh, or buttocks. Each site has its own advantages and considerations, so choose the one that best suits your needs. We'll demonstrate the deltoid for today. This site is commonly used for vaccinations and is easily accessible. Choosing the right site is key for effective medication delivery and patient comfort. Make sure to palpate the area to avoid any underlying structures. 2:00-2:30. Clean the site with an alcohol swab, inject the needle at a 90-degree angle, and slowly administer the medication. Ensure the needle is inserted fully to reach the muscle. Take your time and ensure the patient is comfortable throughout the procedure. Communicate with them to ease any anxiety they may have. 2:30-2:45. After withdrawing the needle, apply pressure to the site and cover it with a bandage if needed. This helps to prevent bleeding and promotes healing. This step helps prevent bleeding and keeps the area clean. It's a simple yet important part of the process. 2:45-3:00. And that's it! You've mastered the basics of intramuscular injections. With practice, you'll become more confident and efficient. If you found this video helpful, give it a thumbs up and subscribe for more medical tips. Thanks for watching. Stay tuned for more tutorials and tips to enhance your medical skills.